Refugee communities, when supported and empowered, can innovate and creatively come up with solutions to address some of their pressing needs. The Twubakane Early Childhood Development Model is an example of such partnership between refugee-led organizations, communities, and institutions like the AfriChild Center.
At the AfriChild Center, we are passionate about improving the lives of children within humanitarian settings. We are therefore prioritizing research in refugee settings across Uganda and outside Uganda. With support from the Hilton Foundation, we are currently implementing a project strengthening research and evaluation capacity for evidence-driven policies and programs to improve child well-being in Africa, and specifically within refugee settings. This project is focused both here in Uganda and Ethiopia.
The Stretch project started in 2023. We started with the formative phase, which constituted 3 studies on political economy, the mapping of ECD scholars, and the mapping of early childhood interventions in refugee settlements in Africa. We also did a baseline for the area where the intervention is currently taking place in the Juru sub-base camp. So those 3 studies were to get us to understand the context of ECD landscape and context to be able to help us to situate ourselves and plan the co-design phase. We came to the community and worked with the community to co-design an early childhood development intervention, which in the wisdom of the community we called a more locally situated name, which we now are calling the Twubakane model. Twubakane means we build together. And this is because this is a community-owned, community-led, refugee-led early learning and development approach or model, which is focusing in the pilot phase on early learning, on responsive caregiving, on livelihoods, and on nutrition and health. So far, the results are very exciting. After very short time of implementation, the results are exciting. On my left, we already have an early learning center built by the community with the support of our partner, Now and Tomorrow, working very closely with AfriChild Center, with the research team, to have an early learning center where nothing existed in the community. The community offered us land, they have offered us labor, they have offered themselves meals, they have done a tremendous job. We repurposed the church, very old, dilapidated church. We did a few repairs here and there and made it usable by the children.
Muri make hariho Twubakane barashoboye kwiga ibintu bijanye n'ubuzima bw'abana guhera ku mwana akiri mu nda gushika kugeza ku myaka 5. Rero nk'abantu batwubakane bivanye n'inyigisho batwigishije, batweretse yuko abana badashobora kuba bonyene, yuko ashobora kubishira hamwe. Abantu bagiye gukora hakagira umuntu ashobora kugira gute gucungera abana. Ari naco gituma AfriChild Now and Tomorrow badufashije mu bintu bimwe kugira ngo turonke ishuri. Abaturage kino kintu barakishimiye cyane, kuko twararitse abaturage turagira umuganda, abaturage baradufasha kumba amatafari.
When we were interacting in the co-design, one of the issues that came up was nutrition.
Yeah.
There was a lot of malnutrition here because people just depend on beans and maize. People take porridge sometimes as a meal a day. Yeah. And we felt like, okay, together what can we do? They said locally here they have some people who can train them. We didn't bring someone from outside. Someone in the cab is the one who said, okay, I can offer to train you people on how to make a simple and affordable nursery bed.
Yeah.
We asked them which vegetables they would prefer or they locally eat. They said, yeah, we can have some spinach, some carrots, some beetroot, onions, dodo. So we said, okay, let's procure those and we see how to start. So we established this, I think, a month ago. And from here, we're going to transplant so that we can put in the other demonstration garden. But also beyond here, we're also planning to make sure they also get the seedlings for their own homes after learning. So we're planning a training, but it will be practical. Do this, apply this manure and stuff like that. But beyond that, we thought of the children. Right now, before these things can grow, what are we doing immediately? So we discussed, and the Twubakane members said, I think they may need some porridge because they start from 8 to around 11 or 12. And they said that's a long time for 3 to 5 year olds to keep without eating anything. And we said, okay, fine. So the chairperson of the village, Mr. Innocent, offered to give the group 10 kilograms, which also motivated the chairperson of Twubakane. So I also have 5. Those became 15. We are watching, we are hearing to make sure it comes from them. Then the other members offered to give 1. They together made 33 kilograms.
A while back, as you can see, the street is empty. It was previously full of children roaming around. Right now, they are inside there, learning to sing, to socialize, being stimulated, learning to play with locally made materials in what was previously a church. I find that to be a very exciting innovation because we have many churches. Churches are free from Monday to Friday. So repurposing it to accommodate children is a great innovation. Secondly, at this time of the day, most of the parents are out in the gardens. Previously, all these children would be unsupervised. The house would be locked. They have no meal. They have no one to supervise them or take care of them. Right now, they are under the supervision and care of 2 qualified caregivers who are able to stimulate their learning, to stimulate their social skills, their motor skills, their gross motor skills, because we've just observed they've made materials with clay and fiber and many other local materials. We see nutrition being taken care of. We see early learning being taken care of as well. So this is really an exciting innovation. The best part about this is that it was a community-led innovation. The community identified a space and said, we know this space. As we set up a more longer lasting, a more sustainable ECD center with bigger space, in the interim, they decided to identify this place, identify the resources around, make some small contributions so that the children can start learning as soon as possible. That's a really great and exciting innovation in this community.
Twubakane oye! Gab oye! Africhild oye! Now and tomorrow is Z! Through its commitment to refugee-led inquiry, academic collaboration, and culturally rooted design, the Twubakane model is laying the groundwork for a new generation of caregiving models, ones that restore dignity, amplify indigenous knowledge, and return power to families navigating life in displacement.
We are deeply grateful to the communities that have embraced our work and to the children whose resilience continues to drive our mission. The AfriChild Center, transforming child welfare through research and action.